Hello and good morning. Welcome to Facebook Live. My name is Dr. Peter Carter, and I am a general pediatrician here in the community in Overland Park and Olathe, Kansas. And as part of our weekly series here at my office's Facebook Live events, we're here just to kind of provide some more education for the community today. And today's topic we're going to be talking about is COVID still. We're going to be talking about going back to school as most families, including my own right now, are kind of a little bit anxious and nervous and excited and all those emotions wrapped up into one regarding our children approaching the school year and what's going to come of that with this virus that's among us everywhere. So we're going to walk through some of those things. It's been awesome. Got a couple questions from folks on Facebook that they've sent those to our group. So I'll try to cover those as we go through and look at some of those questions. I'll do my best to navigate some questions as they pop up. Hey Aaron, thanks for watching. And so shoot those at the bottom and I'll try to look at them. If not, I'll reply after the Facebook Live event as I am not super efficient at doing all that at once yet. So working on all of that. So again, today is July 31st. I guess I should mention this is obviously timestamped on Facebook as well, but all this information is going to be as of today. And as we all know with COVID, this can change rapidly and readily. So we're going to talk about some of the new guidance and updates from the state and from Johnson County and from our local school districts. As I looked at a couple of those plans and kind of, luckily they're very, very similar. And so kind of some of the thoughts from our school leaders and also our health leaders in the community to try to keep everyone safe. And I think that's the biggest goal in all of this, is to not just keep our precious kids safe, but to keep those teachers safe, to keep those folks at home when kids come home and they live with a person who is immunocompromised, or they live with a grandparent who is older or has some sort of medical malady that needs more care, or is maybe one of the higher risk populations, people of ethnic minorities that are higher risk for any respiratory disease in general. So all those things are taken into account in some of these decisions that are being made. So school sounds like it's going to start, or at least plan to start, kind of that first week after Labor Day for a lot of the Johnson County school districts, Blue Valley, Olathe, and Shawnee Mission being kind of the big ones around here. And so that's kind of the goal right now, is for everybody to kind of keep, trying to isolate and quarantine and make the curve for this COVID stuff go down so that we can get our kids into school. Got a great question from Kimberly Howell on Facebook that kind of wondered, well, what's the point of going back into school live and in person? Is it more for the folks with IEPs, individualized education plans, for those that need other resources for their family, for those kids that just need to go to school for safety for so many reasons, for food insecurities? And I'd say, yeah, that's a great question. And those are all answers that definitely are reasons for some families to have the kids go back to school. And so it's something that we need to think about for sure. As great reasons why having availability of in-person learning can be helpful. The American Academy of Pediatrics has done so much evaluation and studying of this type of topic through the years, and especially with COVID, that there's also just other great benefits to so many families, that if we can get children back to school, their emotional and physical well-being are just helped and guided in that. They get more physical exercise sometimes at school by playing with their peers than they would otherwise. Again, they have those peer models to kind of guide them to, to challenge them and to help them learn, and to see other kids doing age-appropriate activities and learning tasks that will also encourage them to do the same. So there are a lot of benefits, and the American Academy of Pediatrics really hopes that we can get back as much as we're able to with the numbers and stuff, and with the trajectory of COVID, get kids back to in-person learning. But that being said, there are going to be options this year. And I think it's great to have those options. It gives you hopefully peace of mind as a parent that you at least have a little bit of control in a time when none of us have any control of kind of what's going on around us. We can only kind of control the things that we can control in our own daily choices. And so it's important to remember that, and that people are really working hard and looking at data to make best choices for everybody. So from what I've seen, at least from a few of the school districts in town, there's going to be some options for exclusive virtual learning, where you just choose, my child for this first semester through the kind of winter Christmas holiday is going to be doing virtual learning at home. And I think that is going to be a viable option for many families. There's also going to be a live school option for a lot of families as well, where they're going to attempt to have kids come to school and just do regular school with some social distancing measures. And every school district I've seen has these large plans typed out in 60, 80-page documents of things that they're working on to make sure their HVAC systems are appropriate. They're going to be running air conditioning and heating at certain times of the day to decrease the spread of aerosolized stuff that could be spreading COVID and other germs. So they're taking great measures to try to mitigate that risk and eliminate it. And then there's going to maybe even be some hybrid models. And as we're all learning about those, a lot of you may have been reading your emails from your school districts this week where there might be a hybrid model based on some gating criteria, which we'll talk about later from the Johnson County Health Department, based where you might have your kid go to school 2 days in a row, and then the other half of the class may go 2 days in a row live. And then those other days you'll be doing some virtual school from home. Not exactly sure as the pediatrician here how that's going to look as far as what do you do on those days when you're home. Is the same teacher going to be teaching you? How do they teach the kids in class and out of school? I don't know those answers, but I know that the school districts are hoping for a more clarity on numbers. Even as soon as August 5th, a lot of those school districts are asking parents to reply to the surveys that are out there to give them information as to figure out how their teachers are going to be divvied up between doing virtual learning and those that are kind of doing in the classroom, and those that might be doing more of the hybrid model of some kids in the class each day to space them out. Obviously, a 20 or 30 person kid classroom isn't going to be able to have that 6-foot social distancing very easily in kindergarten through high school aged kids, just because the classrooms aren't large enough, physical space isn't large enough for that. So there's going to be some options, and the option that is right for you is the option that is going to be right for you. And so looking at the risks in your house, as we kind of alluded to, is there somebody that's immunocompromised in your house? Is there somebody that's caring for your other child that's immunocompromised? Do you have a grandparent that lives with you or helps you with your children? All those things come into consideration, and I just want to remind you to try to find peace with the choice that you and your family are making, and just keep doing your best to wash your hands and face mask and all those kind of things that are going to help prevent some of the issues that can happen from being exposed to COVID. So, I'm trying to look at my notes to make sure anything else we're talking about. So, getting into school age kids, it's nice. So far, the data is still showing that kids under age 10 are less likely to spread this disease. This may change over time. As we're getting back into school, we might see this data change, but this is kind of looking at international data as some of the schools internationally have kind of gone back. So we're hopeful that especially those elementary age kids, there's going to be less risk and less exposure and less disease than there might be in those kids that are older, from ages 11 to 17, 18. Their ability to pass it might be similar to that of adults. So we're going to have to watch those middle school and high school kids more closely. So we'll definitely be keeping an eye on that. Yesterday, or I guess it was a couple days ago now, Children's Mercy had their kind of community talk where the wonderful Dr. Angie Myers, who's their ID kind of lead right now, their infectious disease doctor, who's kind of doing a lot of the education for the community and watching some of the data very, very closely, almost 24/7, I feel like she's doing, and their team is doing there. She mentioned that, she feels comfortable, and I would say the same, and I'm hoping to send my kids to school for the live, I guess my oldest rather, going to kindergarten this year, for the live version, to try to have some of those social interactions and be around those peers for peer modeling and those kind of things. Had an interesting conversation with a family this week, even where they had children with special needs, and they said, "Boy, those peer models are really important there for my kids. Help my kids learn how to wear masks easier, and help my kids just with daily things to kind of learn how to follow directions, and those things that those healthy just average kids can help teach other children those things too. So there's some benefits there. Prep as you're doing whatever it is. If it's in school at all, for sure, mask wearing is going to be really, really important. There really are not any medical exemptions for not being able to wear a mask. I think we've talked about this at length on our Facebook posts, and also just the patients we talked to in the clinic. Children's Mercy came up with the lone medical exemption is if a patient is physically unable to remove their mask. That might be a medical exemption, but most folks, we can keep practicing, and so keep wearing them. Try the different kinds, like the sleeves that kind of are more like a ski mask that kind of go up and over the neck and kind of can slide down. That might be a great option for kids in the elementary school ages, or really any age, as they are wearing a mask and then having to have lunch or things of that nature, where they need to pull their mask down and they're not setting a mask that's clean onto a dirty table, or hitting their friends with it because they're little kids, and then putting it back on and putting a dirty mask on their face. They can more easily wash their hands and pull their mask back up. into a safe place to prevent that respiratory spread of those droplets. So just practice with that. I find that most kids in the office are fantastic at wearing their masks. Even the littlest kids that I wouldn't expect them to keep a mask on, they're keeping it on fairly well. So kind of make it fun, model it. The kids that see their parents wearing them on their way to work or on their way to a grocery store, like, I've got my mask, I'll make one for you, or we'll get one for you that's just the right color or the right dinosaur, or whatever silly message a teenager wants to have on theirs to kind of make it personalized for themselves. You can do that to find a way to make them wear it a little bit easier. So keep an eye on those things. There was a question about the gating criteria in Kansas that's kind of been documented and suggested so far through the Johnson County Health Department, and how is that going to work, based on some of the data in Florida, was the question that we saw on Facebook, that the Florida data is showing that there's a higher percentage in kids. The interesting thing in comparison of those two, that question, I guess, Kansas versus Florida, is the cases that are positive, of those being swabbed that are actually positive, their cases are in the 20 plus percentiles, like 25% of their cases are positive. And in Kansas, I read somewhere recently that we're closer to, usually around anywhere between 5 and I think the last 2 weeks, maybe it was like 8 to 9% of those that were swabbed were positive. And of the children, those numbers, and if it was broken down even to smaller numbers, those numbers decreased significantly. Sometimes even like 2 to 3% of the younger kids under age 2 or 3. So we're just not seeing a ton of disease, at least here at this moment on July 31st again, of children in the Kansas City metro area getting a lot of COVID, which is a wonderful thing. And it is a testament to people hopefully making choices to limit exposures to those kids too. So keep doing that, please. So yeah, it's hard to say what's going to happen in the Kansas state and our surrounding areas as we open up schools. Is it going to change and be like Florida? I don't know if it is. Some of it is our just natural ability to spread out compared to some of those more dense populations in Florida and Miami and places like that where the numbers are really high. So we'll keep an eye on those things and update you as our opinions on that change. Luckily, at the Children's Mercy update the other day, they also mentioned that there's only been one child death in the Missouri state and 0 in the state of Kansas so far for those younger children, which is really encouraging as well. So if they're getting sick, they're not getting quite as sick. They're not being ventilated nearly as much as the adult populations, but just something to keep an eye on. So one interesting thing that the schools have worked on is, we've kind of looked at data, and I know that the Kansas Academy of Pediatrics has a group that's kind of working very, very diligently on this. I know our Dr. Melick is working hard on that too, as part of that group. And they're working with the Johnson County Health Department and some of the local school districts trying to come up with a global way to kind of approach if a kid gets sick, if somebody's exposed, if somebody in their house has it, somebody in the classroom has it, if a teacher has it, what's the plan? And this is all going to be changing. We're kind of looking at a few different models. Children's Mercy is kind of weighing in on this with that whole group we mentioned before. St. Louis Children's is another one that is kind of a group. All the children's hospitals are kind of working on their own protocols that are very, very similar. They're kind of trying to work together, so it's making the most sense for everybody, and so people are doing similar things. But there's just algorithms. This is kind of I'm just going to show it briefly, but an example of an algorithm from St. Louis Children's that might be similar to one that would be adopted in the area for the school nurses to kind of have an idea of what to expect. And the interesting thing that we're looking at is so far the biggest symptoms, that the higher risk symptoms are going to be cough, and like respiratory difficulty breathing, and then loss of taste or smell, and then of course plus the fever. So those are kind of the higher risk criteria. We're noticing that kids, especially with runny nose or just congestion or some nausea, vomiting, diarrhea, sore throat, headaches, muscle aches, those are really kind of lower risk, and most of those patients are, as I kind of alluded to earlier, are testing negative for COVID. So there's a model right now that, and again, this may be similar to what's adapted, but it's not going to be perfect. But if there's one low risk symptoms and no real exposures to COVID, that kid can probably return to school 24 hours after the symptoms resolve, and probably be pretty low risk for transferring COVID. Then there's another breakdown if there's greater than or equal to 2 symptoms that are low risk, and or rather one high risk symptoms but no exposure, then an evaluation by a healthcare provider might be a good idea. And I know that a lot of you have realized we're doing a lot of telehealth visits for this at our office to be able to try to answer those questions for your particular case, and decide, if testing is something that's needed. and sometimes we're able to offer some ordering of the COVID testing. We currently are doing a lot of that at Overland Park Regional Medical Center's drive-through clinic, where we send an order over there and then you drive through the ER and they're able to swab. I know that starting next week, Children's Mercy's urgent cares are going to be doing some drive-through type testing. I'm not sure exactly of their protocols and how it's going to work yet, but I do know that they are going to require an order from a physician. So they're kind of still encouraging folks to see, from what I understand, their primary care doctor. We would send that order over to Children's Mercy, and then the Children's Mercy urgent care at 135th and Metcalf, close to our Overland Park office, will kind of call and navigate getting that swab done. And then there's, the possibility of, boy, does your kid have strep throat? Because that goes around like crazy this time of year as kids go back to school, or some other viruses that go around. And so there's possibilities if, hey, Lydia, thanks for watching. If they have a positive strep test, can they have a comorbidity and also have COVID? Possibly. But if the symptoms all line up great with strep, we're kind of thinking that the possibility of getting them on antibiotics for that, and then on you go. And there's kind of, make sure symptoms are resolving and there's no fevers, and you can go back to school like you would any other calendar year without this crazy COVID that's going on. So obviously, if there's a positive swab, or if there's, exposure in your household or things like that, there's going to be the criteria to isolate and quarantine for, 14 days or so. If they're positive, you can return to school generally, depending on what the final recommendations will be, but within 24 to 72 hours of having no fever and symptoms are resolving and resolved, and at least 10 to 14 days from the onset of the symptoms. So, hey, Leanne, thanks for watching. So those are kind of just some ideas of things for you to think about, that those conversations are being had, and just trying to figure out that risk of everybody. And yeah, so the schools are going to be working with the health departments. They're going to be working with the doctor's offices around town, including ourselves. And we're going to do our best to take care of kids and take care of you and take care of your families and kind of give you guidance. So as we're kind of figuring all that out, I know that the schools, a lot of them, the districts are asking for families to figure out their surveys and have them filled out by August 5th, which is coming up next week. So this maybe will give you some guidance on, hey, what should I do with my kid? So you can kind of give your preference. The school districts can plan. How many teachers are we going to have? How are we going to keep everybody safe? So kind of be thinking about that. And then I know that the final guidance coming from, I think it was the Kansas Board of Education or the Johnson County Health, something was going to come around the week of August 17th to kind of give their kind of final updates, hopefully before the goal of getting school started that week after Labor Day. So I had a great question from Kimberly K on Facebook, and it asked, what about teachers? What about the kids? What do we do when we get home with our kids to try to stay as safe as we can? And man, these are awesome questions, because these are things that we've been talking about here in our office for ourselves and for teachers. And I know we want to keep our teachers safe. By golly, we need and love our teachers in America and here in Overland Park and Olathe and everywhere, as they are such a vital, amazing just resource for growth of our kids in so many ways, and teaching them and loving them and giving them that support in a way that is just a little different than parents provide. And it's just such a neat way that our society works. So we want to keep everybody safe. And so kind of what I suggest is kind of what I've been doing, and most of my doctor colleagues have been doing and medical colleagues for that matter, for a long, long time, as this has all been going down. And I think changing clothes when you get home and taking your shoes off kind of before you get inside, or like right inside your door, have a place where your shoes stay, they don't go around the house. Taking your clothes off right away when you get home, and washing your hands really well with soap and water for that good 20 seconds. Hand sanitizing throughout the day while you're there is going to be really important. But washing your clothes, taking your shoes off right away, that's going to be the most important part. Hand washing, I might even encourage face washing for your kids, even if it's a washcloth, just to wash your face as a teacher or as a student, to kind of remove any kind of respiratory particles, so that way next time your kid inevitably just kind of does this kind of number and rubs their nose or picks a booger or whatever they do, puts their hands in their mouth because they're teething or they just do that, like my kids do all the time. Just kind of keep encouraging them not to do that, and keep their hands clean. And then if you've washed them, you decrease the risk of something going into the respiratory system and causing COVID to kind of spread. So doing that, do you need to take a shower? Definitely wouldn't hurt. Have I been doing that every day when I get home? I probably have. I mean, absolutely have gotten more lax on that, but I definitely wash hands and kind of consider washing that face every day and changing clothes right when you get home and having a new fresh set of clothes, just to kind of mitigate risk again and lower it the best that you can. And for teachers, just wearing that face mask I think is going to be the best thing that you can do, because social distancing is going to be tough at times, obviously. But I think if you can kind of minimize risk, have your mask on. Not be within 6 feet of somebody for more than 10 to 15 minutes, of prolonged, absolute time where you're right there face to face. That will keep your risk a little bit lower. So I think that's all I got for now on that, but some things may come and change over time. A few other things just to think about for some specific populations. Definitely for those that are asthmatic or have had, the need for albuterol as a rescue medicine in the past. This is a really important year for you guys to touch base with us and let's get your asthma action plans updated. So we have a plan should you get some respiratory disease, whether it be COVID or otherwise this year. We're going to be a little more worried that you might get more sick. And, we don't want you to go to the hospital. We want you to be able to manage this as an outpatient. And so if we can prep those plans and get those documents ready and those medicines refilled, so you're not calling last second for refills, or in the middle of the night you need them and you're like, boy, I wish I had that medicine that I haven't been back to the doctor for a while. So call and schedule those visits and let's do that. Some of that we can maybe even do via telehealth, because we're not doing the lung function testing at the moment because of COVID and the increased aerosolized risk a little bit. But a refill and getting that plan printed so you have it at home, and then you also have a copy to give to your school nurse. That's going to be really, really important as we kind of attack this. The other way to kind of help it for asthmatics and then everyone really is getting a flu shot this year. So everything that I've read says, boy, this is a great year to really, really, really promote getting that flu shot. Even if you're of the mindset, we don't do that, we don't get the flu. If we do, it's okay. This might be your to kind of consider just for, not only yourself as always, but also for others, that having less flu around may decrease the load of the hospitals. And, if COVID gets bad in the winter, it'll allow, more of those ICU beds to be there and not be there for people having influenza related illness that can hospitalize people as well. So flu shots, we are hoping to get those kind of September-ish. We always order thousands of doses and they kind of come when they come. So as soon as we get those, we'll try to do flu clinics, and we'll be advertising that via our newsletters that come out. So keep an eye on that, and you'll sign up through a portal to do those things. And then the final little update is, I know that with Kansas Sports and Activities, the Kansas High School Athletic Association, or whatever it's called exactly, KSHSAA, they have a questionnaire that you guys may have seen if your kids are in sports that kind of looks like this and asks questions. And if there's any positives on that questionnaire, they're asking that a medical provider do an evaluation. And so just want to give you a heads up about that. So we're kind of going to trying to be getting folks back into play based on the latest and greatest updates on the COVID recs, and some of which I've kind of outlined, but again, those may change as life goes on. So keep an eye on things. I think the idea for some gated openings is going to be a pretty good one. I didn't want to talk much about that, but you can find information about those red, green, and yellow zones based on the amount of positive tests in Johnson County, and based on the previous 14-day numbers, whether they're rising, steady, or declining. Those are going to be important. It's interesting, and I kind of agree that the elementary school kids will be able to be in person longer, if it's a little bit higher risk than the middle school and high school kids, just because of their less spreading of the disease back and forth. So as long as the school doesn't have a bunch of outbreaks in their teachers, I think that's probably a very safe thing. So we will, again, keep an eye on that, but I think it's some sound reasoning looking at some of their models that they put out regarding that gated back to school plan that they have in place here for Johnson County. So big breath in all of that. Just keep taking care of yourselves, keep loving your children, loving each other, keep finding ways to just spread kindness and joy to each other in this crazy time where we're all a little bit overwhelmed and stressed and kind of feeling, again, as I mentioned earlier, just kind of handcuffed on I don't know what to do. You're not alone in that, so please know that. And if it's crazy overwhelming, I strongly encourage reaching out and getting help from a counselor, or talking to your doctor, or reaching out to a friend you haven't talked to in a long time, and seeing how you can be of help, or say, hey, I need help. It's okay to say that. So I encourage you guys to do that. And that's about all I have for today's COVID update on Friday, July 31st, and the back to school kind of plans that are out there. So today, get excited. I've got my Royals shirt on. As you can see, it's the Royals home opener. There are no fans in the stands, but it's still baseball. And those of you that know me know that I love the Royals, so I'm pretty excited about that, just to at least kind of pretend like it's a semi-normal summer here for a few weeks. So hope you all stay well, and thanks for watching. And hope you guys all have an amazing weekend, and just keep enjoying those families as you guys prep going back to school. Take care.